Now to an expert sports doctor who is a former Chelsea first-team doctor, Dr. Ralph Rogers, who's on the line. Good afternoon, Dr. Rogers.
Good afternoon, Brian.
Hello, I'm here with Martin Allen. I don't know if you picked up the bit about helmets that we were talking about, and that's one of the problems. Obviously, they don't have that in football, but the mechanism is the same, isn't it? You know, the brain carries on moving, and it gets rebounded and hit, and there's a limited amount you can do about that.
Absolutely. I mean, you guys said exactly what everybody else knows. That brain still keeps on going at speed. And it's not like the speed of 20 years ago. These guys are a lot faster, a lot heavier, a lot more hits with a lot more force and energy. So, that's another reason why there's so many brain injuries or concussions.
I mean, it was the case, and I think rugby has now got round this, and NFL certainly has. The fact that people thought it was a bit soft. Oh, go and carry on. You can still carry on. Can he count to 5? Can he say what day of the week it is? Let's ask him. Oh, he wanted to stay on. The last person you should ever ask about a head injury is the person who suffered it, isn't it?
Absolutely. I mean, we hear countless examples of guys who got hit in the first or second quarter of, let's say, an American football match or game and don't remember anything. So, yeah. And again, these guys, it's innate. These guys are warriors. I mean, you remember the day when you got hit, you got back up to show how tough you were. So these, as you said, these are the last guys that you want to ask, can you go on? Because you look to be soft if you don't continue.
The protocol at rugby now has been extended and revised. I think it's getting better. I don't think it's perfect yet. But what do you see in what is the national game over here, football? What are the protocols there? Do you think they're adequate? Do you think the care and the understanding is getting better? What's your impression of that?
Oh, it's definitely getting better from the old days. I mean, although I speak with an American accent, I've been here since '97. I really appreciate football, rugby. It's a great game. I think. There's a lot of debate. Obviously, and for good reason. We're starting to see these mild brain injuries and concussions becoming more evident in the game. And not only that, we know that these injuries can lead to some of the things that we're seeing in the United States. So I think the understanding is a lot better. And then you have a guy named Dr. Willie Stewart, a neuropathologist, who has even gone even further to say, should we not even have these hits or this type of training within this type of training, these kind of hits in training. Now, I don't know about that, but, I think he makes a valid point, because we don't want these young men to continue to have these constant mild traumatic brain injuries, which can lead to, major concussions.
Well, I mean, the work that Boston University did about this, Anne McKee especially, after Bennett and Marleau and so on, the most worrying thing, I think, is the subconcussive factor, that you don't have to be knocked out. And this is a problem, I think, more for football in a sense, because you don't have as many people getting knocked out in that sense. It has to be a mistake. Usually players can time jumps, and so it's not quite like rugby. But the very fact that people are heading the ball an awful lot, and especially when you get a younger age, if CTE is possible from subconcussive hits, then that is extremely worrying, isn't it?
Yeah, it is. And you're absolutely right. But I also look at, how prevalent is this? I mean, we hear the odd case when the traumatic case when somebody dies from a head injury, and that's what we hear. But there's a lot of football, whether it's rugby football or soccer or American football, that's played where kids don't have problems. Yes. So I think we have to weigh up. You know what I mean? I think we have to weigh up what's really real, because life can be dangerous. Crossing the street, and I'm not being flippant about people who got injured in sport, not at all. But I think we still have to live to a certain extent. We still have to enjoy our sport at a very high level. And I'm not saying let's do reckless tackles and reckless hits, but I'm of the era where it was nothing better than either getting hit properly and absorbing that, or actually delivering a hit, which is part of the game.
I suppose one of the things is the consent and knowledge, isn't it? If you give people the knowledge that they need to make the decisions and they consent, then you've got a much better, well, certainly legal case and a moral case to say, well, you know, not caveat emptor is a wrong phrase, but it's valenti non fit injuria. I mean, then, you know, if you accept the risk, but you've got to at least know what it is.
Absolutely. You can't. I wouldn't say it any better than that. I mean, at the end of the day, there are risks to these games. There's risk to skiing. Do we stop skiing? There's risk to running. Yeah, we have to calculate the risk, and we have to try to make these games a little bit safer. I think, you know, as you pointed out earlier, there are a lot of people understanding the risk a little bit better, and we're trying to modify the game a little bit better, so we have less problems with these conditions that, you know, come about, you know, later in age.
And the question of risk also, when you're talking about whether you ban something, whether you modify something, whether you advocate something, has to be borne, if you're honest, about the relative benefits. And we all know that sport has huge benefits in terms of educational performance, in terms of lifestyle choices, in terms of, you know, development, nutrition, obesity. So it has to be taken in a round, doesn't it, this discussion?
Yes, Brian, and you know, that was one of the things that I was thinking about when we first got on the when I first got on the line. There are so many benefits. I mean, just think about, you know, if you just think about some of the guys that I grew up with, you know, not, you know, a few of them unsavory characters that got into sport, actually they turned their lives around.
Yes,
and that's countless. Or you know, people who are obese, they get into sport, it turns their lives around completely. So there's a lot of positive things to sport. So we shouldn't be afraid of sport. Even rugby, football, and American football, it's done countless wonders for you know, a great many people. So I think you're right. These things have to be weighed out.
Okay, that's the voice of Dr. Ralph Rogers, sports doctor, former Chelsea first team doctor, who's making precisely the point that I wanted to make at the end of this. When you're looking at the risks involved in something, you have to balance them against the benefits.